Thank you to everybody who has joined our webinar thus far. There's over 60 people in attendance. You're all very welcome to this afternoon's webinar, which is a webinar brought to you by Sinead Quealy of VirtualVet as part of the VirtualVet Handled with Care campaign for World Antimicrobial Awareness Week. I'm delighted to be joined today by 5 contributors. We have Jeroen de Wolf from University of Ghent. We have Faye Walsh Juilliard from Wake Up Capital, Joe Raven from fair.org, Jude Capper, a livestock sustainability consultant, and Caroline Garvin from the Department of Agriculture, Food and the Marine, based out of Dublin. For those international attendees, that is the Ministry of Agriculture here in Ireland. You're all very welcome. We'll start by letting all the participants give a brief introduction as to what their role is with regard to responsible use of antimicrobials and antimicrobial stewardship. So we'll go with Joe first, please. Joe, if you'd like to give a brief introduction as to your as a stakeholder, what your role is in this area, please.
Thank you, Mary. Hello, everyone. I hope you can all hear me okay. It's an absolute pleasure to be here today. So thank you, VirtualVet, for the invitation. My name is Joe Raven, and I work for an organization called the FAIR Initiative. FAIR is a collaborative investor network representing over 250 institutional investors with $25 trillion in combined assets, focused on raising awareness of the material, environmental, social, and governance risks and opportunities associated and caused by intensive animal production, including the issue of antimicrobial resistance. So our role really is to help investors to identify and prioritize these factors through research that investors can then integrate into their own investment decision-making and active stewardship processes. We also run collaborative engagements, meaning that we enter into formal dialogues with global food companies on behalf of our members to improve company performance. I bring a slightly different perspective to my fellow panelists, given I spend my day-to-day working closely with institutional investors, or rather the shareholders of some of the largest food companies in the world. Investors, as owners of corporate capital, have an absolutely key role to play in helping to reform current systems of production to preserve the efficacy of antibiotics against disease in both humans and animals. Investors recognize that the routine prophylaxis use of antibiotics in livestock production is a leading cause of rising antimicrobial resistance and therefore a major risk to public health. And we've seen changing regulations around the issue alongside consumer behavior and awareness across markets as increasing headwinds that investors are currently grappling with as they look at their own portfolio exposure, a risk which is not only material for food companies, but is also a systemic risk across multiple sectors, including the pharma, healthcare, and insurance industries. Hence why we see a number of investors now asking their portfolio companies across the whole protein value chain for better disclosure, specifically on what actions are they taking to reduce antibiotics use across operating markets. For example, how are purchasers working with their suppliers to ensure policy implementation and adherence, and is antibiotics use going down or not? So looking forward to sharing more insights today with you all.
Thank you very much, Jo, and you're very welcome. Jeroen, would you like to give a brief introduction to your role and its relation to responsible use of antimicrobials, please?
Yes, good afternoon, everybody, and it's also my pleasure to be a member of this panel. I'm Jeroen de Wolf. I'm working at Ghent University in Belgium, where I'm a professor in veterinary epidemiology and leading the veterinary epidemiology group at the Faculty of Veterinary Medicine. And my research field is actually the field of antimicrobial use and antimicrobial resistance in animals, and as well as infection prevention and biosecurity. So we're working from, we're starting with antimicrobial resistance and then realizing that the cause of antimicrobial resistance is antimicrobial usage. So we worked a lot on quantifying antimicrobial usage. I'm also sharing the European group that has developed guidelines on how to measure antimicrobial usage in animal production. But then realizing that antimicrobial usage is causing resistance, the next step is asking yourself, how can we reduce antimicrobial usage? And then we come back to infection prevention and biosecurity, among other things. So there's many things that are involved in this, but we are working a lot on this biosecurity issue and improving animal health. And by improving animal health, we can reduce the need to use antibiotics and further on have all these negative consequences. So that is what my research group is working upon for many years already now, and we continue to do so. I'm also sharing AMCA, which is the Belgian Center of Expertise in Antimicrobial Consumption and Resistance in Animals. And so we advising Belgian government on policies with regard to antimicrobial usage and resistance in animals. So from that sense, I'm also quite familiar with translating research results into actions on the field and into policies. So that is probably my take on my background for this debate.
Thank you very much, Jeroen. Jude, would you like to go next with a brief introduction, please?
Hi, everybody. It's an absolute pleasure to be talking to you this afternoon. My name is Jude Capper. I'm a livestock sustainability consultant based in Oxfordshire in the United Kingdom. And I've been working in the area of livestock sustainability for about 15 years now. And it's been interesting how animal health and AMR and antimicrobial use has really come into it in the last sort of couple of years or so. So at the moment, I'm primarily research-based, looking at research projects involving animal productivity, animal health, and from both an environmental and a social point of view. So often we see negative trade-offs between things that we can do for the environment and productivity, or things that we can do for animal health and welfare that don't necessarily tie in with the consumer's image of animal health and welfare. So working with different organizations, both on a regional and a global basis, and with both individual farmers and consortiums to see what we can do on farm to improve productivity, improve health, and at the same time cut carbon footprint, cut antibiotic use, and hopefully have that win-win both for the livestock industry, for the environment, and for consumers as well.
Thank you very much, Jude. So basically a sustainable One Health approach. Caroline, would you like to give a brief introduction next, please?
Thanks very much, Mary. Can you hear me?
We can, yeah. Well, everybody else, yeah?
Yeah, great. Okay, sorry. I'm on a phone. It's not as reliable. Firstly, I'd like to say thank you so much for the invitation to be here. Particularly like to commend Sinead and her team for what they've put together today and for the whole World Antimicrobial Awareness Week. It is a very interesting agenda that we have today and indeed for the rest of the week. I am a superintending veterinary inspector in the AMR division within the Department of Agriculture, Food and the Marine. And I suppose it's a key strategy for DAFM is the promotion and safeguarding of public, animal and plant health and animal welfare for the benefit of consumers, producers and wider society. And so AMR is a key focus for us. I'm also programme manager for INAP, which is Ireland's first national action plan to address the challenge of AMR. It's a One Health action plan, which was developed jointly with the Department of Health and also the environmental sector. Under that plan, we have 5 key strategic objectives, which are modelled on the WHO Global Action Plan. And I suppose just to say that first action plan is now coming to a close at the end of this year. It was a 3-year action plan. And so we're very much focused on I suppose, reviewing that action plan and, again, the successes we may have achieved, but also the challenges, because we are very keen to drive this AMR, to drive successful action to address AMR into the future. And so I really welcome the discussions that we're going to have today, because I very much see them as feeding into INAP 2, which will very much be, again, a collaborative process with all the industry stakeholders. So just thanks again for inviting me to be here today.
You're very welcome, Caroline. Delighted you can join us. and I'm sure we'll have some very interesting conversations over the course of the next hour and a half or so. It'll be interesting to hear from Jerome with regard to translating research results into government policy, which is really your area is policy development and policy delivery, but it's key to have that communication piece between the research results feeding into the policy making. So next off we'll go, so thank you, Caroline. Next off we'll go to Faye Walsh Juilliard, please, from Wake Up Capital.
Thank you. It's a pleasure to be here. My name's Faye Walsh Juilliard, I'm a resident here in Ireland, and delighted to be amongst a panel of experts here. I'm probably going to be bringing a very different perspective. I'm founder of a newly started venture impact fund called Wake Up Capital, based here in Ireland. We invest for a more sustainable and inclusive future, and we look at investments in Ireland, but also in the Netherlands and in the UK and elsewhere in Europe. We are what you would call impact investors, so we really seek intentionality on the part of the founders we like to back, but also we're looking for innovative solutions that are evolving current practice to solve some of the biggest challenges we're facing in our lifetime. And I would certainly say that AMR is one of them, although it probably doesn't get as much of the energy and attention as it deserves. So I'm delighted to be here. I think from an investment perspective, trying to understand what some of the costs and benefits are of investing in early stage solutions to tackle this problem are pivotal, but I see that there's probably not enough attention paid. I know there have been some new funds started recently who are focusing on this, but I think there's still so much information that needs to be shared with a broader base. And I'll just note as well, my grandfather was actually a pioneering immunologist in California at Stanford University, and was working on immunology before antibiotics, and became quite a promoter of antibiotics. And over his lifetime, of course, learned some of the challenges. And I certainly wish he would have been here today to know that I'm even discussing something that really drove his passion in the world. But antibiotics have been a huge gift to us and to people, to animals, to our planet. But of course, now we have to live with the consequences of incredible scientific discoveries. So I hope that as a venture capitalist with impact in mind, we can help play a small role. And I'm delighted to be here among all of you.
Thank you very much, Faye. And that really does bring us really to the first point of our discussion in terms of AMR. There's quite a lot of fear out there and lack of information on it. And really what World Antimicrobial Awareness Week is to raise awareness about the issues. And what we in VirtualVet are working on this week is raising awareness, but also focusing on the solutions. So really, over the course of the week, not just from VirtualVet, but from organisations globally, we've seen a range of projects, policy advances, and all of you being here today participating, it shows that there is actually more momentum and more activity in this area, and we need to, and it's clear that antimicrobial resistance within agriculture and along the entire food chain, there is more activity there. So I'd like to hear your thoughts on what is next. What do you see as being the next steps that need to be taken in terms of raising further awareness, but also in terms of policy and further research areas? And given that it is International Men's Day, and Jerome is the only male on the conference today, participating today. I know we have plenty of male attendees, but Jerome, as the only male participant, would you like to kick off with that initial conversation starter, please?
Yeah, thank you. I learned about the International Men's Day only half an hour ago, and it feels like we're becoming a little bit an endangered part of society.
We didn't plan it like that, Jerome, honestly.
No problem. I don't feel endangered myself. It's quite okay. I'm quite. But coming back to your question with regard to next steps on the research, is that I think actually what we should really do, and what you also mentioned in introducing the question, is focusing on solutions. I mean, we've been, and within research, we've very long and very detailed described the problem. We know the problem of resistance, and we've learned to know it in great details to very deep molecular level. and we continue to find new resistant genes, I would say, almost daily. However, at the end, the solution is always the same. Whatever type of resistant gene you find, the solution will always be, let's try to avoid that it spreads. And how do we do that? Is by using as little antimicrobials as possible. So I really think that in terms of research, that is the way to go, is really focusing, and to put it a little bit bluntly, we have to get away from the microbiology, and we have to go towards the field. We have to go towards the epidemiology, and we have to also the social component, the psychological, sociological components of why do we use antibiotics. Often it's not only because of veterinary reasons or health reasons. It has to do with attitude. It has to do with certain types of behavior. Often antibiotics are used as a kind of an insurance. And as a veterinarian, I can do little about that, because I can only say that it's likely not necessary. But you really need people that know more about human behavior and how to influence human behavior to work on that side. But I'm convinced that in a sustainable animal production, which we need to go to, and we are shifting towards already, but if we, as the animal production sector, if you want to keep your license to produce in the future, we need really to shift towards a production system which is more or less independent on antimicrobials. It doesn't mean that we have to go to zero on any occasion, but really we have to shift to a situation where antibiotics are only used in exceptional situations, and they're no longer the standard therapy. They're no longer used regularly, and certainly not preventively, and they only are used in exceptional situations. And so the hurdles to use them and should be much bigger. There's many ways to build in these hurdles, but it should not be a very easy and cheap and whatever type of product. So I think infection prevention, to summarize it, infection prevention and behavior is a way forward in terms of researchers. Those are the things where we need to get more data, more information, better tools to improve in the field.
Thank you very much, Jeroen. The team in Teagasc, the agricultural research body in Ireland, they're Anya Regan and her team, and we have a series of videos actually that we will be broadcasting tomorrow. They are currently doing a lot of research in terms of the Alison Burrell is a clinical psychologist and behavioural scientist, so they are really focusing as part of the Safe Food project on the behaviours that drive, the human behaviours that drive antimicrobial usage. So I would encourage anybody on the webinar and all of the participants to just take a quick look at those videos when they go live tomorrow, because they are doing really good work. But then, you know, like you said, from your research results, translating that into policy, we have to follow through with that research and make sure it's delivered on the ground. So thank you very much, Jeroen. What's that echo? Are we okay? Yeah. I know virtual is not ideal, but given COVID, this is as good as it gets. So we might have a few little technical glitches along the way. Thank you very much, Jeroen. Caroline, could I go to you next on that? What do you see, obviously with INAP and INAP 1 and looking forward to INAP 2, the next steps for you along this process?
Yeah, thanks, Mary. Well, I'd very much echo what Jeroen has highlighted there. And just to add in that we're involved in that Safe Food project, but we also have another project that we have commissioned to the ESRI, very much focused on not just understanding the drivers behind people's behaviour, but what we need to influence those drivers effectively. So how we can communicate in a way that that reduces the fear factor, as Jerome mentioned, you know, this over-reliance on antibiotics. So we always view AMR as a behavioural change challenge. That's really what it is. And how you address it is obviously optimising animal health. But what we've seen now is we have done a lot of work on awareness raising. And I suppose in some ways the level of use is not reducing at the rate that we would like it to be reducing. Now, on the positive front, the new veterinary medicines legislation, which will come into, it's already in force, but it will be into effect in January 2022. And that specifically prohibits prophylactic use of antibiotics. And it also only allows for metaphylactic use in exceptional circumstances. And the vet will have to justify any use of antibiotics in those, if it's used in that means. So we have the legislative controls coming down the line, if you like, much tighter, much stricter, because that new legislation, the driver behind the new veterinary medicines legislation was AMR, and in essence protecting public health. So in terms of what do we need to do, we need to get the use of antibiotics down. That's the bottom line, really. And it's figuring out the best mechanisms to do that. I mean, we've had an awful lot of collaboration through INAP and through our Animal Health Sector Implementation Committee. We've developed guidance, codes of practice for responsible use for the farming sector, for all the individual sectors, beef, dairy, sheep, pig. And so it's having those guidelines. It's not enough to have them out there. It's, I suppose, to translate the guidance into action. And so that's where we want to go with INAP too, but we certainly want to focus on getting more tangible results around reduction in use. Another mechanism where we'd be better able to look at that is the development of an e-prescribing database, and this is something that we hope to have in place by the end of next year. Again, we'll have to have this database moving forward with the new regs, but we're aiming to have that in place by the end of 2021. So that will better allow us to evaluate prescribing practices and to engage with vets that may perhaps not have what we would consider optimal prescribing practices. So the work is, how do we get the reduction in use? And we are putting those actions into INAP, and also to acknowledge that there is a lot of research done that shows the actions. We are also working through INAP to translate the research into, to communicate it better. To communicate it better to industry, so that the tools that have been developed by the likes of Jerome and his UGEN system, which we are very much engaged with now in the pig sector and moving into the poultry, so that those research tools can be implemented directly on farm. So that's just a few comments from me, Mary.
Thank you very much, Caroline. Faye, I might go to you next, please, if you don't mind.
Sure, thanks. Yeah, I guess from our perspective, sort of in the early stage, venture, and in VirtualVet is an excellent example of this. I think for investors to first prioritize AMR as an issue and a challenge, which they can play a part in solving, but validating there's a need for tech-enabled solutions to help within the supply chain, and that could be, for example, for vets, for farmers. And those technologies need to be able to deliver the data that we're speaking about and communicate that. So to me, that would be an area that I think is really important. It's one thing to tell the farmers and the vets and the meat producers, you must do this, but if they don't have the technology or the tools to do that, it might not have that behavioral change that we're looking for. So I think that's where we can see technology as a way to bring them in to the fold and make it simple and easy, as opposed to a penalization. And then I think having those technologies in line with whatever regulations are most appropriate, but also in a cost-effective way. And this could also be seen as an added cost, and with slim margins already, that's really challenging. So how can a company such as VirtualVet help bring value, but not much be a big drag on the cost? I think is really important at this stage. And then also, how can vets, farmers, meat producers also be rewarded? What is it about reducing antibiotic usage in meat production that's beneficial in the eyes of the consumer? So I know, for example, in the US, you can go into fancy meat markets, and if it's if there's no antibiotics, that's seen as a sort of premium product. How can we get that more into the public eye? And is that something that an early stage company can help participate in, and because I think we're really trying to make a connection from the farm to the table. So we need to bring everybody along that journey. And right now it's quite fragmented, which is where I see innovation and technology playing a role in this world. So I hope that as investors, sort of at that early stage, we can help think through the solutions that start from, you know, the end user here, the farmer or the meat producer, all the way to somebody maybe making a purchasing decision in a store. So those are some of the solutions or the areas that we'd hope to play a role, and I think are pivotal for this massive behavioral change, which is not unlike what we're facing up with climate change. It's a massive, complex issue that requires multiple players to be involved, but it's not there's no simple panacea neither. So, thanks.
Thank you very much, Faye. The two main points that you touched on there, really, in terms of the data and the available data. I mean, all farmers in Ireland are, you know, the regulations are thus that they have to record all animal remedies, but it's actually utilising that data to make it meaningful. And you touched on consumer values there and what consumers want. We actually have. Sorry. I didn't want to do it just yet.
No problem.
Sorry. We have a consumer, a video of a consumer survey, and we also have a video from John Massey with regard to data. So those two main points, we actually have clips coming up on that now. Before we go to the video, thank you very much, Faye. Before we go to the video, Jude, I'll pop to you and then to Joe before we do the consumer survey video, please. Thanks, Jude.
Awesome. Thank you, Mary. I'm in danger of saying all the same things that everybody else has already said, which in some ways is really nice because it means that we're largely on the same page. So I'm not going to repeat anything, I hope, that people have said, although I've been nodding and grinning, you know, all the way through going, yes, 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 yes. Okay. Certainly from the work that we've been doing, we did a project with Bristol University and HDB Beef and Lamb just last year, and I think one of the is and a better measurement on farm. You know, from a legal point of view here, we have to keep records of all the medicines used, but the ways that that's done ranges so much from apps to random little bits of paper to every cow has a different file card. And so being able to integrate all that data, collect it, benchmark it becomes really, really, really difficult. And I just want to pick up on one point that was made earlier about this being very similar to climate change, because I've been working in the carbon footprint area for about 10 years now, and I was really struck by how many similarities there are in terms of how do we measure medicines use, what are the right metrics that we need. The metrics debate is one that certainly here in the UK has been going on, you know, constantly, and I still don't think we really have it resolved. And the other thing is, you know, I worked in the States for 18.5.
Oh, your sound.
Over there, different processors had significant opportunities to change what was done on farm far faster than actually legislation could change it. So, for example, use of the bovine growth hormone, RBST, in dairy was changed almost overnight simply by pressure from the retailers. So if we can get better integration from the processors and the retailers in terms of affecting that behavioural change, I think we can make some really fast progress, whereas we do tend to rely on policy and legislation and regulation. But if, you know, grocery store X says that's it, no more highest priority critically important antibiotics in our beef, for example, you know, things change almost overnight. So I think we have an opportunity there.
Thank you very much, Jude. And then finally, Joe, before we go to our consumer video clip, please.
Thanks, Mary. I think I'd like to pick up actually on Jude's point around retailers adding pressure on the sort of success so we can have that. I guess from my perspective, coming at it from an institutional investor perspective, meaning pension funds and large asset managers that are invested in the capital markets and in many of these large publicly listed companies, I think there's a few things that I'd like to see. Is one is actually seeing these large institutional investors becoming much more vocal and openly discussing the importance of AMR to a wider audience than they have previously. to send really a clear signal to the market that this is a material issue and that their portfolio companies, similar like what they're asking on the climate side, need to take action on this issue. And that is something that we are working very closely with, and hopefully next week you'll see some more big commitments from a number of institutional investors on the issue. But I think secondly as well, there needs to be a significant improvement in terms of company disclosure as well on how some of the large, and on the retailer side, on the actual supplier side, how they're actually tackling the issue of AMR across their value chain. Because I mean, I go through hundreds of different annual reports and companies on a regular basis, and there's a large majority that do have policies in place, but we're still missing, you know, how is usage being measured? How is supplier compliance to policies being monitored, for example? And we need more investors also asking these questions to these portfolio companies, and then companies will have to respond. But ultimately, there's no doubt that without regulation, there is a limit to how much change the investor community can help promote. And I think all of this action needs to be supported by regulatory frameworks that promote this responsible and judicious use of antibiotics globally.
Thank you very much, Jo. Thank you, everybody, to your initial contributions there. We're now going to run the short video clip from Anya Regan. Oh, was I muted?
When it comes to antibiotic use in agriculture, a lot of the public in agriculture, a lot of 62% of the consumers surveyed 62% that they do not currently have enough information about the use of antibiotics in agriculture. This follows on from focus groups that we carried out last year with consumers. Those focus groups showed that those consumers who knew less about the use of antibiotics in agriculture, concern tended to be higher about farming practices. This shows the need to proactively engage with the public on this issue.
Apologies, I think I was muted just before that video played. Caroline, I might come to you on that first, seeing as that is a Department of Agriculture co-funded project. You know, is this consumer pressure, is it real? And where else, apart from the consumer side, where else do you think the pressures are coming from in terms of this need for behavioural change? You're on mute, actually, Caroline. You're on mute, Caroline.
I've unmuted.
Oh, yeah.
Sorry.
Okay now, I think.
Can you hear me now? Yeah?
Yes, can hear you. Yeah.
Oh, great. Sorry, I'm just having a few technological issues. Yeah, I think the whole area of consumer pressure has been coming to the fore more and more in recent years. And I mean, we've seen it particularly, you know, this message about antibiotic free. And, you know, it's not a message that we would support in terms of it's the concept of responsible use of antibiotics that's important. Because if you go down the road of insisting on antibiotic free in all cases, you will certainly and most definitely compromise animal health and welfare. So, you know, it's about promoting the right message and the correct messaging to the consumer. But certainly we've seen in the US in particular that, you know, even the likes of McDonald's are going down this road of promoting antibiotic free as being, as you mentioned before, the premium product. I think we would be much more comfortable with the concept of responsible animal production and, you know, use of antibiotics where necessary, but certainly as a minimum. The other comment I would make, I suppose, is that we have seen the direct impact of the processors taking on board consumer concerns, particularly in the poultry sector. And we are now really at the forefront in terms of driving, leading in the poultry sector in terms of the reductions that has been achieved by the processors. We have one of the lowest levels of usage in poultry production in Europe, and indeed many people come here to see what we have done. But that was an industry-led initiative. It wasn't driven by legislation or regulation. The industry could see that there was this consumer concerns about the way that their food was produced. And so they stepped in and dramatically and significantly reduced their use of antibiotics, but at the same time brought in other measures so that they didn't compromise animal health. So there is a role, certainly consumer concerns will drive it at the retail end, but it's to ensure that it's driven in a responsible way.
Absolutely, Caroline. It really is a very valid point. Jerome, would you like to come in there, please?
Yes, thank you. Well, I would happily comment on the issue of responsible use, and I fully support the idea of responsible use, but there is a big problem with that, and the fact that it is not defined, because it's very hard to define what responsible use actually means. And if you ask any veterinarian in the field whether he or she is using antibiotics responsibly or not responsibly, they would all answer to you that they are doing it in a responsible way. And that's actually also an honest answer. That's how they are trained, that's how they are educated, and that's how they do it. They feel that it is in a responsible way, although as an outsider or as a researcher, when we look at what they're really doing, it's not necessarily always fully responsible. So if we continue in our message towards veterinarians, towards governmental responsible, simply mention we have to use antibiotics in a responsible way, the risk is that nothing will change. So, and that's a discussion I've had very strongly here in Belgium with our government and with our veterinarians and farmers. If 10 years ago we would have said we're going to use antimicrobials responsibly, nothing would have happened because everybody was convinced they do it responsibly. We said, on the contrary, we're going to reduce the use of antimicrobials, and we reduced with over 40% since. So it is, the word reducing is quite important, I think, and only focusing on responsible use is not, to me, is not a strong communication message, and you risk that you miss the effect that you want.
Thank you, Jerome. So we're back to the behavioural changes there and that are required across the entire agri-food sector, and also the communication piece. I'm smiling to myself here because 20 years ago when I qualified as a vet, I went out to examine an animal which in my opinion didn't require an antimicrobial, so I didn't give it antibiotics, and the farmer rang up my boss and said, I don't know what sort of a vet that one is, she didn't even give it a shot of antibiotics. And to some extent there is that opinion out there still that you're not doing your job, and you're not doing your job unless you administer at least something that looks white in a bottle. And that's also part of the Safe Food Project, looking at that behavioural change and that relationship between the vet and their client, their farming client, and how do we change that behaviour, that behavioural pattern, and this over-reliance on antimicrobials. Anybody else want to come in there on the consumer pressure is real? Jude, would you like to say something on that there about consumer pressure or pressures from other areas, please?
Yeah, absolutely. And I mean, of course, by definition, everybody is a consumer of something. But I think this question of consumer pressure is an interesting one. As we saw in the video earlier, when we ask people the direct questions, you know, if you ask people outside the grocery store, are you concerned about the use of antibiotics? Everyone says, oh yes, it's terrible, it's really bad, you know, it's a big issue. When you ask them what they actually understand about it, often they don't know. And frankly, if you ask them the open question about, you know, what are your concerns with animal farming, they'll say welfare, they'll say safety, they'll say environment, you know, et cetera, et cetera, et cetera. And antibiotics tend to be relatively low down the list. Now, having said that, I think the consumer pressure is real, but from a relatively niche group of consumers, and often to some degree being pushed by the activist groups. In the work that I do, I've seen an awful lot, both in the popular press and in the scientific press, where antibiotic use is used as a sort of tool or a messaging point for, and this is why we shouldn't have animal agriculture because it uses so many tons of antibiotics. You know, everyone knows this is bad, etc., etc. So I think generally speaking, when a retailer gets a query, you know, we have to be very clear about the difference between a casual consumer query from someone who's simply genuinely interested and a consumer query with the aim to push some kind of agenda, which unfortunately we are seeing, particularly with Brexit in the UK and US trade deals, etc. Antibiotics is being used as a sort of messaging point in a way that it perhaps wouldn't have been used before.
So to some extent, it's falling into the post-truth political landscape of that emotional sensationalist. So really, those of us, you know, involved in the profession and involved in this need to take a hold of the issue and make sure that communication is clear and responsible with regard to the responsible use and reduction of antimicrobial usage. We have a poll up there at the moment about, are you concerned about AMR? If our participants and attendees would like to take part in that. And just before we pop to, we have John Massey's video in a few minutes. Joe or Faye, would you like to come in on the consumer pressure, given that you're coming from a different perspective than the other participants? Joe, if you'd like to start, please.
Yeah, no, I mean, this is obviously something that is very close to our heart, and obviously the work that we do at FAIR. And I think we talk about the consumer a lot, and we often forget about the role of the shareholders in these companies. And I think I wanted to share with everyone just an example of the sort of role that investors have to play. And we've already seen the impact that engaged investors on this issue can have on the sector. So, for context, for over 3 years, FAIR, alongside 73 investors, have been working with 20 global fast food companies to actually establish comprehensive policies to, I think on Jerome's point, to reduce and phase out this routine use across all species and set clear targets and timelines for when this is going to happen, and ultimately publicly report on how this is occurring, how it's being measured and how it's being monitored. And by mid last year, we saw some really good progress with, first of all 20 companies recognizing the materiality of AMR to their business, and a large majority of these companies actually moving beyond, especially in the US, beyond simply following national regulation and towards reducing or even prohibiting this routine use of antibiotics. And I mean, and for context, back in 2016 when we started doing this, only one of this company was even considering the issue. And I think another tool that I'd like to just touch on briefly is the number of shareholder proposals, meaning what is submitted to regulators in the US, where investors can actually formally ask companies to phase out this routine use of antibiotics. That's increased significantly over the last few years. Between 2010 and 2015, we saw only about 4 shareholder resolutions being submitted to food companies. And but since 2016 until now, we've seen this increase 5 times as the issue becomes one of great importance for shareholders. And to demonstrate the impact that this can have when you have your shareholder base voting for this, there's one large US poultry producer which for many years actually had a public campaign and multiple shareholder proposals, but the company actually previously publicly denied any sort of risks associated with the overuse of antibiotics in farm animals. But at the end of 2018, nearly half of its shareholder base actually voted in favor of stopping the use of medically important antibiotics in the company's operations. And then the company responded at the end of the year with an announcement saying that it would discontinue the use of medically important antibiotics in live poultry operations. So I think it's the intervention that the investment community can have is immensely powerful if there is alignment and clarity on what needs to be asked for these companies. And obviously this example I've just shared is not unique. So there is a lot of behind the scenes happening, but we just need to amplify that.
Thank you very much, Joe. Faye, would you like to come in on that?
Sure, I'll just come in very briefly, just building on what Joe's just mentioned. I think, again, for early stage companies, that would be tackling this challenge, which is not a simple one. For us, we'd like to see what the metrics are that we could measure on with them to know that their solution is actually working. And this goes back to directly what the previous speaker was saying about alignment of what is the goal we're trying to achieve. Yes, reduction in antibiotic usage and irresponsible usage, but how will we know we're doing that? And for a technology or solution that's trying to, again, I'll point to VirtualVet who's trying to do that. If we were to invest in an early stage company like that, and then in 5-10 years time, we're going to say, well, look, we did this, the company grew, their valuation is wonderful, they got bought by this, and they're now in every vet office and farm globally. Okay, that's lovely. So we sold a lot of widgets, but how do we know it was actually working? So what are the key metrics that are telling us that we're helping to chip away at the problem? And we would identify potentially it's the reporting on drug usage has been significantly increased because this innovation helped that happen. Or, there's a significant reduction in the misuse or overdose of antibiotics, which has then resulted in a decrease in the amount of kind of AMR sickness issues or illnesses in the human population. Those are the kind of metrics we would need to deliver upon as an impact investor to know that an investment we made is actually working. But we need to make sure those are the right metrics and that they're actually attainable and possible for sort of an earlier stage company that has potential to grow. And that's going to require alignment from research institutions, the governments who are creating the policies, and also keeping track of what the retailers and the consumers are asking. Because otherwise we can't do it in a vacuum. So there's certainly a requirement of enormous collaboration to understand how will we know it's working. So that's just want to throw that in there.
Thanks, Faye. So basically that vacuum that you're talking about, that gap that needs to be bridged, like what do you think are the barriers to getting across, crossing that bridge, crossing that vacuum, filling that vacuum? What do you think we need from your perspective? And I'll ask all the other participants in a moment. What's key to bridging that gap?
I take this to the macro level. I don't think there are enough people in the world who are losing sleep over this right now. Okay, and if there are not enough people losing sleep over it, there's probably not going to be enough money and attention being paid to it within the public arena, etc. And frankly, there's plenty of other problems people seem to be focused on right now as well. So how do we keep this issue in the public eye and make it important so people are talking about the way that a lovely young Swedish woman is keeping climate change in the public eye, of course, among many other support thing that's going to is it a story? Is it a story of somebody who lost their lives or their loved ones because of this? Is it a story of all the data we can share about the adverse health effects in countries around the world because of AMR? I'm not sure. I don't have the exact answer. I mean, if I did, I'd probably have a different job right now. But I think it's that human story to help people connect with this problem that I think is missing. I'll give you one example. Sorry to make a detour, but like, for example, tuna fishing, okay? People didn't realize that there was a problem with tuna fishing until they got really excited and sad about the dolphins who were dying, okay? But the dolphin was the thing that got people to care about how to fish responsibly. I mean, it wasn't really about the dolphin, but people somehow wanted to know and care for the dolphin. So I know it sounds like a strange parallel, but it's how do we reach humans who want to connect with this story to make them realize this is important. And therefore, they'll want to buy the products that are responsibly created and made, invest in the companies that are responsible, and that they won't lose money doing it, and that they'll actually have a benefit of a health outcome as well. So I know dolphins seem kind of out of picture here and out of scope, but just popped in my head.
So I appreciate the analogy, Faye. I think there is that fear factor and the head in the sand attitude towards an issue like this because of the feeling out there maybe that there is a lack of solutions. And Jeroen spoke earlier about the solutions that need to be brought to the table. And we need more advocates and we need more people concerned about it. Caroline, could I come to you next on that? What do you think are the barriers that you're experiencing, or in your opinion, are affecting, change, this behavioural change that's required?
Well, I think, and firstly, just to highlight that there has been a lot of advocacy for AMR on the human health side. Can you hear me? Sorry, I was getting...
Yeah, hear you perfectly and see you. It's perfect. Okay. Thank you, Caroline.
Yeah, grand. No, just wanted to highlight that it is correct. It is about how you message it. And, we have focused heretofore, I suppose, in promoting it as a human health concern and trying to make it real for people in that way. And we had our own webinar yesterday, and we had Professor Martin Cormican speaking, who's the HSE lead on the AMR infection control team. And he highlighted the wealth of work that has been done in the human health side to make people aware. And we're all aware now that, when you go to the doctor with the flu, you can't expect an antibiotic. The messaging is going out there. And I think you make it relevant to people on a personal level first. And then it's like the dolphin story, then they buy into it. But in terms of the challenges that we see around this behavioural change, it is about how you communicate. In terms of measuring reduction in use, yes, we acknowledge the data that's out there at the moment that we have in the HPRA reports is crude sales data, and that's why we're trying to move to this e-prescribing database so that we will collect data at the prescriber level. The end goal obviously is to have data at farm level, but that's a hugely complex endeavour to achieve. So we are taking the steps to have the data, and that allows you to measure change, because you can't improve what you can't measure. So I suppose that's the challenge that's out there for us at the moment around that. And again, Jerome mentioned about, what is responsible use. I suppose, again, until you have the use data out there, it's hard to put metrics down, if you like. We haven't gone down the road of setting targets for reduction at the moment, because we don't have sufficient data. And there's a danger with setting targets in a crude way, that you could reduce your overall volume, but you could increase the use of the highest priority, critically important antimicrobials. So you have to be careful about how you set targets. So I think, we have established a database on the pig side where we are collecting the farm level data. But again, it takes time for people not to be afraid even to submit their data. What are we going to do with the data? So it is all about effective communication at the end of the day, I think, and then using the scientific evidence to support what you're trying to do.
Absolutely. Thank you, Caroline. I suppose, not trying to be contentious here, and I do appreciate that the human medicine side are driving forward with the messaging, but there are some of us within the agri-food veterinary area who are concerned about the underreporting of AMR on the human side, and feel that those of us involved in agri-food production and in livestock production, that because there's so much data gathered on farms already with regard to animal IDs and rightly so, that there's so much information available at the moment that we are targeting the lower hanging fruit in terms of recording and getting more information from farmers, as opposed to it being done in tandem with the human health aspect. I'm not saying two wrongs make a right, but I think it would be helpful if we had more information from the human side. They're doing the communicating, the veterinary communicating and strengthening. We need to look at this from a One Health approach, and I think everybody needs to be seen to be playing their role, and an important role in this. What would you say to those of us who might be leaning towards that, Caroline?
Yeah. Thanks, Mary. I suppose just to point out that we did publish a One Health report under INAP, which brought together exactly the information you're talking about. So we do have it out there. We have that information on the use in the human health sector now. It was only at hospital level, but we were told yesterday that they are now able to collect data on use at pharmacy and community level. So they are collecting the data. And in terms of the incidence of resistance in the human health side, that also is collected and published by the HPSC. So I think as we work more closely together into the future and develop the next One Health report, that explains it from both sides of the coin, if you like. So I wouldn't fully agree with you that the information isn't there on the human health side. I think it is, but it's probably not being shared as much to the agri-food side as we would see it on our side as regulators working with the Department of Health. But maybe we need to transmit it a bit more out there, because it was very clear. We have a National Interdepartmental Consultative Committee, which was the genesis of INAP. It was very clear at that meeting that this is not about a blame game. It is not about saying one sector is driving it more than the other. It is something that we work on together. We both have roles, both sectors have roles, both are using the same antibiotics to treat the bacterial disease. So I wouldn't fully agree that the information isn't there on the health side. Maybe it's not as visibly shared or available to the agri-food sector. That might be the point, really, that's of more relevance.
Thanks, Caroline. That's very reassuring. And it is all that information joined up together in a One Health collaborative effort, really. And we had a community pharmacist contribute to the campaign yesterday. So we all need to work together on this. And as you said, avoiding the blame game. Faye, before I move on to the other contributors, Faye, you mentioned, people have way more to be worried about at the moment because of, I assume you were alluding to COVID-19. Actually, some of the work that the Safe Food Project have done has shown that COVID-19 has actually focused people more on health and the important things in life and biosecurity and raising awareness about where their food comes from and people cooking more at home. So it's actually been it's interesting. And also in terms of collecting the data, Caroline, that you mentioned from the pharmacies and the GPs, COVID has actually increased digitalization from what I've heard from doctors and pharmacies. So that which was once you had to have a piece of paper that had to be handed in, now it's gone all digital, so it's actually going to be easier to collect that data. Joe, can I come to you next, please, on the barriers before we get to this?
I think from one of the areas, and I mean, this is a regular question that I get both from companies and from investors when we're having our conversations, and one is around the fact that it requires an upfront investment, and there is a real lack of understanding of how much a transition to a production model that is independent from antibiotics would cost. And I think seeing more clarity on this topic is key to continue to build the business cases. Who absorbs those costs? Is it the consumers? Is it the farmers? Is it the actual producers? So I think there needs to be a better understanding of that, and I think being able to look at examples and showcase what best practice looks like, I think is key to just overcoming that barrier and to helping promote the discussion a lot more and get more investors involved and companies on a global basis. So not just in Europe, but also in the US, Brazil, and in Asia as well.
Thanks, Joe. Jude, Jerome wants to go in there. Sorry, Jerome.
Yeah, well, I just wanted to come back on something that was mentioned before about how do we motivate people to work on this, and then this fear issue. So we need to install the fear in the consumers. I'm not fully convinced whether that is what we should do. One thing you can do is creating this fear, but that can work also paralyzing. So I'm much more thinking about showing the solutions, and there are plenty of solutions out there, and there's plenty of farms that are really already, and farmers that are really already today working in a very good manner with very limited use of antibiotics. So showing that it's possible, I think is a much more positive approach than working on the fear side to motivate people to enhance in this. Another thing with the link to the climate change is good, But on the other hand, let's be honest, climate change is a bigger problem than antimicrobial resistance. And I think it's important that we also dare to say that. I mean, and from my position as a scientist, we need to be honest brokers. And I think it's very important that we not preach the end of the world every day, because the next day people will notice that the world hasn't stopped, and then you lose your credibility. So focus on solutions, explain people that it's possible to solve it, and explain that it's important that we deal with it, but don't pretend that this is going to end the world tomorrow, as it is not. And especially not the component of veterinary medicine, veterinary antimicrobial use with regard to, there is a link, and I've been doing research on it for 10 years, I know about it, there is a link, but what we're doing in animal production is not the major cause of the problems of resistance in humans. So speak about that honestly. Explain people about this and with all these nuances, and sometimes that's a bit complex to have to explain these nuances, but not explaining them for me is not a good idea as well. Just my last comment about the metrics. There are plenty of metrics. The measurement of antimicrobial usage at farm level is really well developed. I've put a website in the chat to show you. There's over 15 countries in Europe already and over 30 different systems installed already to measure. So we can measure what we do, but we have to further enlarge that and demonstrate with these measurements, with these metrics, which I believe are crucially important, demonstrate that there are farms already today managing to do it very well, and then show others that is the way forward.
Thanks, Jerome. And for our attendees and participants, Jerome has put a link up there to the acting.org, which is a project that he's involved in. And talking about data and data analytics and what's happening, we now next have a clip from John Massey on data usage from the University of Bristol.
Hi, my name is John Massey. I'm a PhD student at Bristol Vet School, working on addressing some of the challenges to data-driven research into antimicrobial resistance in UK livestock. I've been asked to talk to you a little bit about the ways in which data regarding antimicrobial usage in livestock are collected and shared. I believe it's vitally important that high-quality information regarding usage of veterinary antimicrobials and the context of that usage are collected and shared throughout the value chain. With this, we can develop best practices for veterinary antimicrobial usage and, most importantly, provide evidence of that best practice being followed. We only need to look to the recent publication of the SVAC report on antimicrobial usage across Europe to see the great work that's been done by producers and veterinarians all across Europe in reducing antimicrobial usage and, most importantly, the highest priority critically important antimicrobials. By having access to the context of that usage, colleagues at Bristol Veterinary School and other research institutions have been able to show that these reductions in usage are possible without any detriment.
Nope. All right, I'm unmuted. So that's interesting from John Massey on data. Jude, I'm going to come to you first on this one. How do you think, in your opinion, how do you think that we can work around these barriers through looking at the data, as John has mentioned there, and as Jerome had mentioned, looking at the data all along the food chain, from start to finish, from farm to fork? What are your thoughts on that, the barriers that we can overcome?
Great question. I actually worked with John last year on the HDB and Bristol University project that I talked about earlier. And yeah, data collection is so difficult. We were primarily working with beef farms in England. And as I said earlier, there's a legal requirement to collect that data, but the quality of the data, the detail of that data varied so very much, from every cow having her own individual little card to people being utterly electronic with every single tag and date and quantity and medicine recorded to, oh yeah, we gave that one with the horns a shot of that stuff in the bottle. No, we think it's still, I mean, it's crucial that on farm we get a far better handle on how to record medicines use, what has been in what. I'm very hopeful that the LIP program over here in the UK and integrating medicines into an e-medicine hub, as they've done it in the pork and poultry industry, will really help. I think the sectors that are less integrated, i.e. the beef sector, the sheep sector, and to some extent the dairy sector, have a far bigger challenge with food farm to fork traceability. And again, certainly in some of the focus groups that we ran last year, talking with vets and talking with farmers, obviously I won't mention their name, but there was one suckler cow producer who said, well, it doesn't matter what I do with my calves, because by the time they go to market, they're 18 months older, they've gone through 2 or 3 other farms. What I do on farm doesn't make any difference. And I mean, this was an informed producer who would come along to a workshop focused on microbial attitude of the informed people, then it's quite frightening to think what might be the attitude of the bottom 25% or so who don't engage. I really liked Jerome's comments earlier about showcasing best practices. Again, there's some data from Bristol University in their farm animal practice. They took out all of the highest priority critically important antibiotics in the dairy herds that they treat over a period of 5 years. I mean, they reduced it to 0 with no impact either on perceived or actual productivity, health or welfare. So it can absolutely be done, but there is, in a different way, that fear factor of, well, I can't possibly do that. I can't do this on my farm. And we desperately need to showcase better. And just one final point, and utilization, human antibiotic use, save for one thing, and that is that if we give an injection of an antibiotic to an animal, then we know that animal has had that antibiotic on that day. If we give a bottle of pills to somebody, we hope they're going to take the whole course at the appropriate time, with or without food, 3 times a day, etc., etc. And I may be lacking the knowledge of it, but in my experience, nobody's ever checked that I've taken those antibiotics, taken them in the right way, at the right time, etc., etc. So I think we can be confident that generally speaking, the prescribing data we've got for animal agriculture is pretty good. The prescribing data for humans is good in terms of what goes to the people, what people actually take, and at the right times and in the right doses, I think is probably far more variable than we all understand.
Okay, Jude, your line has gone a bit fuzzy there, so I'm going to, thank you very much for that, Jude. We actually have a live poll there in terms of what would be the most valuable information in your role for all attendees and participants, whether it be on-farm usage at animal level or animal remedy sales. That's a bit like what Jude said. What we're recording on animal prescribing habits, what farmers and vets are administering. And Caroline mentioned sales data. It's basically what we have for humans is the sales data. We're not actually sure what's being used out there. So it is more of a collective response is what's needed. Joe, I might go to you next in terms of verifying this data, verifying the information for investors. We've talked about barriers and bridging that gap. What are the potential wins for everybody along the food chain if we do find solutions and if we do work together to find solutions? The potential wins. Does that make sense?
Yes, yeah. So, I mean, in terms of from an investor perspective, I think an obvious one is that you will see commitment from investors on a long-term basis to hold your company for longer, basically. So, and your shareholder base will be maintained, and you'll be. And I think it's this demonstration that companies who are taking action, they will ultimately be more resilient and will have long-term profitability. That is the assumption, but around that win. And the one thing I just wanted to briefly make just a comment around some of the challenges, and I think it's something we've really touched on yet, and is really around, we talk about moving away and becoming, towards production systems that are independent of antibiotic use. And I think one of the areas that we look at is around demand for protein. And demand for protein is expected to continue to rise significantly over the next decade and longer. And I think it's this idea of if we don't look to diversify as well our protein sources, and our ability to sustainably feed these 10 billion people by 2050 will be at risk. And how can we feed just animal protein even with these new, more sustainable production systems? I mean, that is a big question that we get from our investors, whether that is possible if we move away from these intensive systems. And I'd be interested to hear everybody's thoughts on that. Well,
thanks, Joe. So in terms of, okay, thank you very much. Faye, would you like to come in on that?
Sure. Actually, I'm smiling because I was going to bring up an area that I'm very interested in, which is cell-based meat production, which I know is still very early days. But I do think I would agree with the comment just made that, I think there is going to be, and there already is, a demand for alternative proteins, whether it's, meat-like proteins that are plant-based, or the advent of cell-based meat. And I'm actually an investor in a startup in that space because I do think there's potential there. I think it's important to consider and to think about, but that's not necessarily solving the challenge or the problem of today, right? There is demand for meat on a large scale, and I don't think that's going to go away. It may shift and change. But I guess for me, I want to go back to the farmer, because to me, the farmer is already under so much pressure, and their role on the planet has, especially with the onset of mass production of food post-World War II, no thanks to my home country, the farmers really struggled. So it's not just a health issue. It's also a social issue on behalf of the farmers who are really, I feel for them. I really do. And I think whatever solution we can come up with, how we can showcase best practice, I think it also can't be to the detriment of those farmers, because they are producing the food that we eat. And as you've mentioned, the demand for food's going up, the population is going up. So how can we help bring them along and not continue to just point fingers because they're the ones there on the field? How can we also elevate their status and have gratitude for them, and maybe help them by designing great innovative solutions to make practice of farming more sustainable, more responsible. I think we should just make sure to keep them front and center. And I guess as an early stage investor, when I would look at an solution, an agricultural technology solution, I often think, what's this going to do for the farmer? How is this going to help them? And by the way, how is it also going to solve that big social environmental problem we're trying to solve? I just think we can't leave them out. So just make a little. You'd think I'd come from a family of farmers. I actually don't, but I do think they're a key part of this.
Thanks, Faye. Sorry, I've just been told we've got 20 minutes left, so we'll work towards our closing arguments in our closing discussion in the next few minutes. How can we work towards finding these solutions, Faye? I know VirtualVet have been working on a project. VirtualVet have been working on a project with XLVet. So XLVets, Jude, I'm sure you're familiar with XLVets in the UK. Here in Ireland, there's been Project Engage, where we have, where VirtualVet have worked with XLVets to look, measure, monitor, similar to what Jerome has been doing. And somebody said earlier, you can't manage what you don't measure. And what we saw in the farms that participated in this project is that antimicrobial usage reduced significantly. So when people weren't afraid, when you took the fear factor away from it and the communication was clear, and that relationship between the vet and the farmer, where there was a tool that could be used to look and monitor and measure, antimicrobial usage actually dropped when that key communication piece took place. So apart from that as an example, and sorry for diverting into that, what do you see? How can industry help farmers? Faye, you talk passionately there about farmers. What solutions do you see that industry can offer farmers in this sphere?
Well, again, I mentioned technology earlier. I think a tool that's obviously where the user experience is designed specifically for use, whether a veterinary environment or a farm. So having deep input from both vets, farmers in those product development, I think is really, really important. It can't just be designed somewhere in a vacuum, because otherwise it just won't be used. And that's pivotal. If the data is not collected, then it's a nice tool that nobody wants to use. So I guess for me, I think research institutions paired up with any kind of accelerator, incubator, who wants to invest, who's already investing in ag solutions, but specifically having a focus on this area, I think would be great. I know that exists elsewhere, but I think in Ireland that would be excellent. That this becomes a pivotal core focus. I know there are other solutions where we're trying to help farmers and herd managers, track online, the health of the animal. But if it's not user friendly, it can be very challenging. It just won't be used. And then the data, of course, needs to be translated and correctly interpreted. I think, sorry, I just lost my train of thought. I guess the other piece is about the cost. Who's going to pay for this? Who's going to pay for these tools? What kind of model is it? We're all acknowledging it's a collaborative effort that needs to happen, but who at the end of the day has the willingness to pay for these solutions? Who is the customer? And I think that's still unclear, to be really fair. When I think of this world, the margins are already very slim. But is it the farmer? Is it the vet? Is it the meat producer? Is it the retailer, or is it the consumer, or is it spread out along the way? And is it maybe the government that comes in and gives some kind of a subsidy? I'm not sure, but to me, that's a real issue here as well. Even if you park the fear or the concern of changing practice, I think that also comes down to cost, because they're really running such thin margins that it feels like, oh no, how do I take this on? And the same for the meat producers, So that to me would be an area where I'd spend a good chunk of time thinking and thinking it through before throwing out a bunch of products that might never be used.
Thank you very much, Faye. We might go to Jude next. I was going to pop to Caroline there when Faye mentioned government and policy and subsidies, but I'll go to Jude first and then we'll go to Caroline. Is that okay, Jude?
Absolutely. Absolutely. I hope I'm not repeating too much, because I know this has been said before. Sort of social side points to peer-to-peer communication between farmers in terms of sharing best practices. And so in terms of what the industry can do, facilitating those workshops, those meetings, those farm visits, those, this is what I do with my dairy calves compared to this is what I do with my sheep. That really seems to get people engaged, get them thinking, get them talking about what they could do on farm. So from the sort of practical on farm level, which is where I sit, basically, I feel like that is the biggest thing that can be achieved at the moment.
Okay, thank you very much, Jude. Caroline, can I come to you next on that, please?
Yeah, Mary, if I could just comment on a few things that the other panelists have raised first. Maybe just in terms of showing the solutions, and I think it's a very positive approach to take that Jeroen has referenced. And we certainly do have the evidence that farmers can do it. And we have had conferences over the years because we know the value of peer-to-peer learning, as Jude referenced. I mean, sitting in a group with other farmers will have much more impact than someone from the department coming down and telling them, or whoever, So we do have, I suppose we have these discussion groups already in place around the country, the Teagasc driven or the farm advisory discussion groups, and they are very, very useful. And yes, we have the farmers that are doing the best practice and getting awards at EU level even with what they have done. it's getting that translated into every farmer buying into it. And so as the last speaker referenced, the cost is a huge issue. And maybe something we need to ask ourselves as a society is the price we pay for our food. Is it realistic to pay €5 for a chicken? You know, and so I think the cost has to be spread out. I think it's unreasonable to expect the government to be the sole carrier of the cost. Certainly, I think, yes, the farmer there will be some buy-in required at the farm level and veterinary practice level, but the processors, and just to say, I suppose that's the one sector, the retail side, that we haven't had as much engagement with in terms of INAP that we would like. We would like to see more leadership coming from them, and we have engaged with the retail forum through the FSAI, and we're just not getting the buy-in. Perhaps we're not reaching the right people at the retail level, but you know, that sector, you know, has a huge influence on I suppose what they pay the farmer to produce the food and what the consumer pays to consume it. So I think the cost needs to be spread out, and that will then allow the economic investment that will allow best practice on farms. And, you know, farmers may then invest in better data collection systems, you know, because as you said, we have the paper trail and then we have the electronic version. So to collect the data, there has to be investment. So, you know, they're the issues that I see. I think we have the building blocks, but it's to cement them together in a way that everyone is acting in their own, you know, in the best interests of society as a whole.
Thank you very much, Caroline. And it's funny, you know, when you said that farmers can't be expected to bear the brunt of the entire cost, all the participants are nodding their heads. Some of the comments on the chat room have been on about consumers aren't willing to pay for whatever higher quality food that has cost more to produce, but consumers aren't willing to pay. But as you rightly said, the retailer and the processors are there in between. So it has to be more of a joined up conversation all along the food chain. It can't be just the farmer at one end and the vet and the consumer at the other end. We all need to be working collectively on this. Jerome, I might come to you on that one, please. You were nodding there in agreement.
Yes, absolutely. The role of the retailers is very important, and it's also my experience that they are quite passive in this field, and so they're more. They do not take on this leading role which they could take on in this, which is it's a pity, and it's quite interesting to see the investor side and the shareholder side being here in this field. For me, that's a totally new group of people being engaged in a discussion. It's very interesting to see that, and maybe they know better how to activate these often very big companies, orientated towards providing the cheapest products to their clients, or in one way or another. So we need to find a way to get them on board in this whole story, because if they continue to use, as they often do, meat as a cheap way to attract customers to the stores to sell them than expensive other products where they have much more profits, so make much more profits, then it's gonna stay a very difficult issue. So I would rather see people in Europe eat a little bit less meat and pay more for the grams meat they are eating, and that would be, I think, a win-win for many sides.
Thank you very much, Jerome. It is wonderful to have investors having a different perspective, because it's usually the farmers, the vets, the medics. So it is great to have such a diverse panel here. Joe, I might come to you on that to respond to Jerome and the challenge, the gauntlet he has thrown down to yourself and Faye in terms of how to get processors and retailers on board and be more involved in this conversation.
No, and it's a great question, and I think it's, I mean, for context, in terms of the investor community, for many years, the whole sustainable food system topic was not a priority for the investor community. And that is why the initiative FAIR was created to fill in that knowledge gap. And I think we've seen a real change over the last 2 years where now the institutional investor community understands that there are a wide range of environmental, social issues that are having an actual impact on company performance, and that action needs to be taken. And I think in terms of the retailers, it's really interesting that you've drawn them out, Jeroen, is through some other work that we do with the retailers. I think what we found, at least through my conversations with a lot of those big global retailers, a real reluctance, at least until about 12 months ago, to actually engage consumers and actually move beyond just simple education, but actually towards behavioral change, saying that that is not their role. They just provide options and choice on products. But I think that is now starting to change, because there is a realization that business models are going to have to change if we want to address climate and other social risks and AMR as well. So there is now that recognition that both brand manufacturers but also retailers need to engage their consumers and figure out how to nudge consumers to transition their diets. And that includes eating higher and better quality meat, but less of it. And then I think this is where the role, Faye, of what you mentioned on the food tech side, cell culture and plant-based proteins, this diversification of protein sources is super important, because ultimately, at least for Western diets, we do need this transition, this dietary transition, if we want to achieve everything we've just spoken today in this panel. So, but again, there is a big education piece that we still have to do with investors, because it's still not all the investor community that is taking action. And I mean, that's something that we will continue to do so. But what is starting to help is changing regulation, seeing consumers being a little bit more vocal around that. And we've actually seen, for example, companies that have been moving towards cage-free egg production, for example, as a response of greater animal welfare, consumer and civil society pressures, and especially leading US retailers that have committed to going cage-free, for example. What we've seen is that this has caused demand and price for caged eggs to drop. And some of the largest US producers, egg producers, have then seen their earnings being impacted because they weren't ready to respond to this change in demand. And therefore, there's been an impact on their bottom line. So investors are paying close attention to this, and that is now prompting this conversation and this getting companies to start in their journey to transition these models. So we're working on it, Jeroen.
Very good. Thank you very much, Joe. So we're nearing the end of our webinar. We'll have to finish up promptly at 3:30 at 3:30 because people have other meetings. So if I could just do a quick whip around the table and ask people for 30 seconds of a closing comment on World Antimicrobial Awareness Week and what you think, where do we need to go with this, please? Jude, I'll go to you first, please. Can you hear me, Jude?
I think this has been a really great panel. I'm really pleased to have been part of it, and it's been great to hear so many diverse views. If I had my druthers, which is what my boss in the States used to say, meaning the thing that I could have that I would like best, it would be for us all, whether we're within the industry, whether we're retailers, processors, consumers, to have a better understanding of AMR and the factors that influence it and what we can do to influence it on an individual basis, whether that's by taking our human medicines, better or more promptly, whether it's being more responsible and indeed, as was referred to earlier, understanding precisely what that means with using medicines on farm. And just finally, and because I'm not sure it's come up, it isn't just antibiotics. We've got to think about the use of all medicines and particularly how we can better use vaccines, for example, because it's an that we don't know the disease issue, we need to do something better. So better welfare, better housing, better reproduction, better nutrition, and use of effective and affordable alternatives to antibiotics in future. But again, thank you so much. It's been really enjoyable.
Thank you so much, Jude. Jeroen, can I have your closing comments, please?
Yeah, well, I think it's important to see that we've come already a long way. I mean, this Antimicrobial Awareness Week and Day has had a tremendous effect in the last 10, 15 years in terms of awareness. We found a number of solutions. We have people already engaging into it and applying it on the field, which is good. And I think this panel illustrates where we have to go towards. This approach on the full value chain, not only farmer-veterinary interaction, but engaging also the slaughterhouses, the retailers, and the consumers and the shareholders of all those big companies is, I think, the way forward to get this really moving. But I'm quite optimistic. I'm optimistic about the fact that it's possible, and it's already demonstrated on the field that it is possible. And now it's a matter of enlarging these actions and getting everybody on board.
Absolutely. Thank you so much, Jeroen. Caroline.
Thanks, Mary. It's a hard one to sum up, really. I suppose on my list would be, I suppose that everyone would take personal leadership around it and really stop and look at what they've always done. And maybe not continue to do what they've always done because they thought it always worked. It is about changing behaviour. It's about education, understanding, and translating that into action. But it's something that everyone has to do. And as Jeroen said, it travels the whole way down the production systems. And I think it's been really interesting hearing it from the investor side today. It's not something I would have considered really, in the past. So I think it's about everyone taking collective and collaborative leadership.
Thank you very much, Caroline. Faye, would you like to add some closing remarks?
I would just follow on also with Caroline. This has been a really interesting group to be part of as well. Great learning, and I'm really delighted to have participated. I guess what I would like to say is I'm looking for what I'm always looking for, which is mission-driven, innovative entrepreneurs with amazing solutions for some of the biggest challenges we're facing, which affect how we live every day, how we eat, learn, work. Because to me, those solutions for today are the ones that are going to kind of help in the future for the world that we leave to the next generation. And I have enormous faith, not just in the folks here at the panel and all the work that they do and their incredible knowledge well beyond mine, but I actually believe, and I know this is sort of cliche, but the next generation of consumers and investors will help in this effort. I know the researchers are there and really working toward this and government as well. But I do believe that the conscious consumer of the next several decades is going to really help drive demand for this. And then, of course, hopefully some of those young people are also coming up with brilliant ideas that we can scale and help solve the problem. Maybe we don't have to have that big public push for this. Maybe this will just happen because all of us come to the table and invest in great solutions. So thanks for having me, and it's been great eye-opening information about AMR.
Thank you, Faye. Joe, we're nearly over time. We're actually over time. Have you any quick closing remarks before we wrap up, please?
Well, I mean, first of all, a huge thanks for the invitation, and I echo my fellow panelists on this. And I think we just need to continue to connect these different stakeholders, as change will only be achieved by adopting and having this more unified and clear alignment of what is it we want to achieve as well. So I'll leave it at there. And thank you again for allowing me to be part of this discussion today.
Thank you to each and every one of you. Great to have research, policy, on the farm, sustainability, livestock, investors. Thank you to everybody who has attended. There's loads of good messages out there. There are solutions on the ground. Let's all work together collaboratively, take personal responsibility, as Caroline said. We'll put the blocks together and move forward. Work with the solutions that are there. And find better ones for future generations. So thank you very much. Please do follow the rest of our campaign throughout the week. It's running until next Tuesday. We've loads of interesting pieces from Teagasc, from behavioural analysis, from Disarm, so from loads of projects, international and national. So thank you very much to everybody and enjoy the rest of your week. Thank you.